Hi, this is Dr. Reilly. Today I'm going to be talking to you about acne. And it's not going to be our regular kind of talk as you might expect from acne. It's going to be talking about no kind of creams or anything like that. It's actually going to be about some of the things that I think that really we don't talk about enough. And it's going to be sort of the nutrition of acne. So, but first, what causes acne? And there's like four kind of accepted reasons why someone will get acne. And these are related to the production of sebum, excess production, the hyperproliferation of the bacteria there, the skin cells, blocking the follicles, and different kind of inflammatory mechanisms. And this graph is, or this picture is supposed to be showing you how all these different things kind of all lead to getting acne, right? But I kind of want to start with a question. And I guess the question really is, what does everyone get acne? And then the answer is no. So there are definitely cultures in the world where people have noticed that the inhabitants don't get acne, and this was first noted by Cordain and Schaefer, and yeah, some of these peoples, they don't even have words for acne because their people don't even get acne. So that's the real question. Why is this? Why do some people get acne? Why when you become a Western civilization do you get acne? And we think we kind of know a little bit, right? What's going on with this. It's usually due to something in our diet, right? And so one of the things that we question is whether or not it's going to be missing some of the nutrients that when you eat a more simple kind of ancestral kind of diet that you actually have. And this is kind of broken down very nicely in this paper where they think that it's the processing of the carbohydrates, some of the dairy kind of stuff and vitamins that we're missing that actually seem like those are things that are actually leading us to getting acne. And so we're going to talk about this kind of in this talk. So one of the questions is if we're missing vitamins, then maybe if we all became like vegans, then perhaps then we would that would do a good job for us. And actually this paper kind of looked into that and they saw that, yeah, there was actually really no difference between becoming vegans, but there was a difference if you were sensitive to grains. So it definitely seems like that grain sensitivity, as evidenced here by having antibodies against some of the gluten inside food, that seemed to cause you to have more acne. And then for them, they saw that actually if you had low the vitamin D, that was actually very indicative of having acne. So perhaps this is going to be something that we see is that it's actually not enough plants and maybe too many grains. That's actually what the issue is, and that perhaps what we should be eating is less things like wheat, rice, corn, etc., and eating more things like broccoli and lettuce. Perhaps that'll actually be helpful for us. And along the lines of that is that kind of diet would actually be very anti-inflammatory. And as we saw in the first picture, that inflammation seems to lead people to getting acne as described in this paper. And one of the things in food that's very inflammatory are the vegetable oils that now are very pervasive in our diet. And there's definitely a thing where some of these canola oils, corn oils, soybean oils, they are very inflammatory. And when we put kids on an anti-inflammatory diet, that's one of the first things that we want to get rid of. And we usually replace those inflammatory oils with less inflammatory oils like olive oil or avocado oil. And dermatologists know this. This is actually from the American Academy of Dermatology Association. And they know that if you eat a diet that's very high in grains or a high glycemic kind of diet, that you're going to get more acne. And so unfortunately, though, this is something that takes a long time for them. So it tends to be something they have a lot of other treatments that they want to use. But they've done studies where they put someone on a low glycemic index kind of diet, one low in sugars, and this is the results. They see that actually the acne actually decreases a lot. So it seems like if we are going to want to attack acne without medicine, one of the first things we should do is we should alter the diet. And when we alter the diet, what we should do is just try to have like a low glycemic index diet, right? So low glycemic index, again, just means diets that are very low in fast absorbed carbohydrates, ones that are high in things like fish and salads and vegetables and things like that. Dairy is surprising because usually we would think of dairy as being something that would be actually very healthy, but there is definitely something about it that actually causes us to get more acne. And this has actually been known for a long time. And what we think is probably this is that milk is specifically designed to grow a baby mammal. And some of the effects that it uses or that it has on your body to kind of cause you to grow kind of causes acne to grow in a simplistic way. Now, we talked about vitamin D before, and whenever I give a talk like this, it seems like the vitamin D is just good for everything, and acne is no different. And one of the things that they've done is they've done studies where they look at kids with acne and without acne, and what do they find? They find that people with acne have lower vitamin Ds, and the people who have less acne have higher vitamin Ds. So then that sounds like something that perhaps we should be checking everyone their vitamin D when they come to see us for acne. So that usually would be something that I would like to do. And one of the things that one of the problems is that we don't really have good guidance on what's the perfect vitamin D level for someone who has acne. So we have to go to the endocrine societies and look to see what is perhaps the most healthy vitamin D levels. And it seems like between 40 and 60 is probably the most healthy. So probably when we're presented with patients, or for you yourself, when you have your vitamin D checked, you probably should be shooting for one that's a vitamin D level that's a little bit higher. And they've done that where they looked at kids who had acne, and what they did is in this study, they gave people who had low vitamin D, they gave them 2,000 IUs of vitamin D, and what they saw is that there was improvement in their acne after a short period of time. So one of the things that I guess when I was a young doctor, we were always freaking out when we gave people vitamin D, and really we shouldn't really worry that much. That our body actually has mechanisms to protect ourselves from vitamin D, and certainly, if you gave way too much for too long a time, you can get yourself into trouble. But it is actually kind of a slow process, and we seem to be designed with mechanisms to protect us from having too much vitamin D. Certainly, for example, when you get exposed to the sun, you can actually produce hundreds of thousands of IUs of vitamin D, but your body actually can very quickly shuttle that into inactive forms of vitamin D, which could be one of the reasons why when people are treated with mega doses of vitamin D, it doesn't seem to have the same effect as when we take a certain amount every single day. So yeah, so that's definitely one of the things that I would recommend, is that if someone is having acne and they're looking to get treated, they should check their vitamin D. And one of the other things I would like them to be checked is their vitamin A. Now on this slide, I purposely put a lot of the orange vegetables because this is something that very often people conflate, that the beta carotene is vitamin A, but it is actually not. And vitamin A is something that's fat soluble that you usually get from eating animal meat. And unfortunately, it's the kind of thing that some people are not very well equipped to convert these orange kind of vegetables into vitamin A. And so they could be under kind of the delusion that they're actually having appropriate levels of vitamin A, and they're not. So when we look to see in the Merck manual what are the normal levels of vitamin A, they actually come up with a level that's actually fairly low, 28. They consider to be a normal level. But when they look at people who have acne, it seems like people who had come to a clinic where they were looking to see if they had acne or not, seemed like people who had their vitamin A levels above 42, they didn't really have too much acne. So you would think that actually probably should be a level that we should try to attain if we're going to be treating a patient with acne. And they've actually done this where there was a shortage of Accutane, which is a medicine that they give people for acne, and they actually treated them with regular old vitamin A, and they were able to actually do a nice job. Now, this is something that's been done for a very long time, where people have used vitamin A to treat people with acne, and these are two kind of papers that we are able to download off the internet that talk about using vitamin A. The problem with vitamin A and all these kinds of things is that they're a little bit kind of finicky kind of vitamins where it is actually possible to overdose yourself. So really probably the best thing to do is actually to check a level, see if you're low, and then take vitamin A to get you to a level that actually is more appropriate or more healthy. And usually it seems like vitamin A works a little bit better when you give it with vitamin E. So probably it is a good idea to give the vitamin A with vitamin E. But this is something that you really need to be a doctor to kind of take care of, because in researching this talk, I have seen on the internet that some people just decide to give themselves any old dose of vitamin A that they could come across. And this is something that can make you sick. So here I put in an article about a poor unfortunate person who decided to treat themselves with vitamin A, and they gave themselves way too much vitamin A. And unfortunately, she was left seemingly with permanent liver damage. So you can imagine that's a very bad outcome for something like acne, where we have other treatments. Now, omega-3 fatty acids also, almost every talk that I give, it seems like that omega-3 fatty acids are also very good. And omega-3 fatty acids are one of these things similar to the vitamin A. Now, unfortunately, there are no plant sources that are very good. So it's better to get your omega-3 from fish, right? So, you know, it is the kind of thing that they've done studies where they looked at people who ate more seafood, and it seemed like they actually got less acne. And as I have in this study from 1961. So, you know, they've noticed that. So then what they said is, let's give some kids omega-3 and let's see how they do. And what they found was that actually, yeah, it decreases your acne a good bit. And they've done that even with a little bit less omega-3, like a gram of EPA and 700 milligrams of DHA. And this is the effect before and after the omega-3 supplements. And it seems like it actually does a good job, right? Now, in a lot of these studies, they don't really check the omega-3 levels, which I don't know if that's really the best way to do things. Perhaps the people that don't have the best results are people who already have normal omega-3 levels. So I would also recommend people to get their omega-3 levels checked, so that way you can know if you're somebody that would benefit from getting omega-3. And it's not just acne, you know, they've actually done this. And in this study, they actually looked at their acne and their mental health. And what they saw was that, yeah, that giving people omega-3, not only did it help their skin, as you could see from this picture, but it's the kind of thing that also helped them with their depression. So the omega-3 seems to decrease inflammation, as we saw in the first slide, that it seems like inflammation causes acne, but inflammation is also kind of accused of causing more depression, especially in children. So it could be something that we could be helping somebody with one treatment that would help two different problems. Probiotics seem like there is a role for probiotics. So there was a study done with Lactobacillus rhamnosus, and it seems like that actually does a good job in terms of decreasing acne. When they did the study, they saw that people who were taking placebo, that they didn't have any benefit. But when people took the probiotics, it seemed like nearly every single person had an improvement in their acne. N-acetylcysteine, NAC, also something that it seems like is good for everything. And it's a very strong anti-inflammatory agent. And it is also linked to helping people prevent them from getting heart disease and different kind of mental health issues. But it seems like it's also good for acne. And so they've done studies with this as well, where they give people N-acetylcysteine at its normal dose, 600 milligrams twice a day. And it seems like it pretty much decreases your acne by at least half. So since it seems like it has other effects and very little side effects, I've never seen anybody who had a side effect. It really is one of those things that it could really be a no-lose proposition. Now, N-acetylcysteine is not something that you would necessarily need to do a lot of tests for your bloods, although we do have some tests for inflammation that might be useful. This is another study where, again, they gave the N-acetylcysteine, and again, they saw the acne decrease in half. In this study, they also used something called silymarin, which is found in milk thistle, which is also used for people when they have liver issues, that seem to be very effective. And in fact, they did studies where they actually gave the silymarin with the doxycycline, and it seemed like the combo seemed like it did a better job than just doxycycline by itself. And actually, when they gave the milk thistle by itself, it seemed like it did a good job. The only thing about milk thistle is it's a plant, and usually these kind of plants are usually the ones that are most likely to be problematic when you go to buy it as a supplement. So I'm not sure if I'm as crazy about wanting to use that, and I probably would save it if I had someone who was in really big trouble and I was having a hard time finding anything else that worked for them, or if I had someone perhaps who had non-alcoholic fatty liver disease, where it seems like it also has a good efficacy. But we don't have that problem with zinc. When we have zinc, it definitely, we know that how much zinc is inside the bottle. And zinc is one of those things that it also has anti-inflammatory effects. So it seems like it would actually be very good for some of the problems that are secondary to inflammation, like acne. And so they've done studies like that where they look at people, and again, they look at their zinc levels, and they see actually people who had acne, they had lower levels of zinc, right? But perhaps those lower levels of zinc, which are technically in the normal range, were actually not the optimal levels of zinc, which perhaps are going to be doing a better job in helping to prevent acne. And this also is actually fairly well known. So the NIH actually puts out papers for professionals to look at. And in one of these papers, it talks about how that some of the labs will actually have too low a level reference range for zinc, where it seems the optimal level should be between 80 and 120. And as we saw on the previous slide, that actually probably for, if you have acne, you would want it to be at least 100. But in some labs, I'll actually see the level down in the 60s, which are actually in the level where we see growth retardation in children. So it's hard to say that's a normal level if there's not enough zinc for the kid to actually grow. But for some reason, the labs are not very clued in onto this fact. And this is, again, one of the reasons this slide will show us why, again, grains may be a little bit problematic when you have acne, because grains especially produce these what we call anti-nutrients that block the absorption of minerals, especially like zinc. And perhaps that's one of the reasons why we see that grains are not the best option for people when they're having acne. And this again shows, they talk about again how zinc levels are very low. And this level also says, even using the low levels of zinc, they find that 8% of kids would actually be having an unacceptable level of zinc. So this is actually all kind of makes sense. And you could think of zinc as being something that kind of gets used up when you're growing. So perhaps this is another reason why kids tend to get themselves into trouble when they're growing, because they're consuming the zinc to do the act of growing, and then it predisposes them more to acne. But not all zinc is created the same. So this is a slide that I just wanted to quickly show you that they've done studies where they give people zinc oxide versus zinc citrate or zinc gluconate, and they see that some of the patients, when they were given zinc oxide, nothing happened. They didn't absorb any zinc at all, even though it's being sold as a supplement. So probably we should be sticking to zinc gluconate or zinc citrate as those kind of options. And unfortunately, zinc is one of these things like vitamin A, where you can get yourself into trouble if you think that, well, a little bit of zinc is good, so a lot of it of zinc must be better, and that's not true. We want to warn people that you can get yourself too much zinc, and certainly it's for adults, usually they'll say 30 or 40 milligrams is okay. But this is, again, one of those things that to check your levels, right? If you check your levels and you have a low zinc level, then you need zinc. If you don't have low levels, then you probably are not going to benefit from zinc. And having low zinc has multiple tiers. So one of the things that we see is that if you don't have enough zinc, then that's going to affect your vitamin A, and your vitamin A is not going to be able to produce, and that's going to affect your iron levels, and it's just going to be all like intertwined. So we have to make sure that we're actually having adequate amounts of the minerals. And this I just kind of put in where they did the same thing like they did with the milk thistle, where they actually gave zinc plus antibiotics, and they saw zinc plus antibiotics works better than just antibiotics by itself. So acne and PCOS. So one of the more common hormone problems that we see is something called PCOS, which right now 1 out of every 9 to 1 out of every 10 girls is afflicted with PCOS, and we actually have videos on our channel regarding PCOS, so I'm not going to go into that right now. But one of the hallmarks of PCOS is acne, and one of the treatments that we have for PCOS is something called inositol. Inositol is also a B vitamin, and it seems like it's particularly good for when people have PCOS. So this study shows that by treating kids with PCOS, we actually have very salutary effects at decreasing their acne. The normal dose is usually 2 grams twice a day. We also, this is just another study that also showed this kind of stuff where they treated them with the inositol, and they were actually get even like resolution of the acne. Now, if you combine myo-inositol with NAC, it seems like that even works even better, right? So this is actually all great, and they've actually done the study where we give metformin, which we sometimes use for people when they have PCOS, and if you use that plus the myo-inositol, that works even better than for acne. And metformin is also something that we find from plants, but it's actually kind of more purified, so then we could be more having a reliable estimation of how much medicine is in it when we prescribe it, because it actually is a medicine. And what it does is it has multiple effects in our body, but it seems like it actually is helpful for acne. And so there are a couple of sources here that I put that actually show how the metformin is actually good for ladies when they have the PCOS, but it's also good for guys too. So it is like something that we kind of have an idea how the mechanism works, although really all this kind of stuff is all just kind of guesstimation. But if we're kind of stuck and we're not really sure what's going on, and especially someone that we kind of have the suspicion that they're insulin resistant, then certainly using metformin would be a kind of a safe option, especially since one of its known side effects is decreasing cancers, which would be nice. Berberine is also something that's used for PCOS, and it seems like it is also helpful for acne. So whenever we can get something that kind of treats two things with one, that is usually great. And then finally, the B vitamins. So B vitamins seem like that they have an effect, and especially pantothenic acid. Pantothenic acid is also known as vitamin B5. That seems like it's found in multiple kind of foods, but for some reason, if we give a higher dose than we normally would get from foods, that seems like it actually does a good job in terms of fighting off the acne. So this study, they had looked at that where they gave a little bit over a gram twice a day, and they could actually see a nice effect in decreasing acne. And this study as well, they kind of looked at that. Now, one of the things that we see with some of these studies is what they do is they mix the vitamin with a whole host of other kind of things. I usually think because they're having some kind of hope they can patent it and then sell it to people at like 100 times the cost. But really it's the pantothenic acid, which is thought to be what's doing the heavy lifting in these kind of studies. So, and pantothenic acid is definitely one of those things that is available, and it's safe, right? So this is also, again, from that NIH website where they kind of guide us. And it seems like even when you give like super high dose, so if you were looking to give 1 gram, they've tested it even up to giving 10 grams a day, and it seems like that actually had 0 side effects, so that's great. One of the other things that where you look, it says that perhaps pyridoxine might have an effect for acne, and some of the dermatologists seem conflicted about this, whether it's helpful or hurtful. There seem to be a very small amount of articles, or really hardly any articles or studies that are done with it. This one is from before I was born, and it did seem like that giving vitamin B6 is kind of helpful for acne, but there's definitely a lot of sites where they say for some reason vitamin B6 is poor for acne. And I think it's because it was a lot of times given with vitamin B12, which it seems very clear that if you are taking a vitamin B12 supplement and all of a sudden you get a whole bunch of acne, it's from the vitamin B12, and perhaps you should just stop the vitamin B12. So vitamin B12, definitely bad for acne. So if you're watching this video and your plan was to go buy a B complex, I don't think that is a good idea. Biotin also is one of these things that it seems like that it could be good. Biotin is very well known for people taking it to help increase their nail strength and for hair density, and perhaps it has a good function for that kind of stuff. It seems like that it does perhaps have a good effect for if you have a special kind of acne. But again, it's not one of these kind of definite kind of things where I have a really good study where I could show you. So I'm not sure. I probably would save that one also in case I had somebody with big problems. Lactoferrin is not that way though. Lactoferrin is actually something that's found actually in baby's first milk, and it seems like it's very excellent anti-inflammatory, antimicrobial. It seems like it has a lot of good effects. So it can actually hit acne at two different kind of ways that it would cause problems. And they've done studies at the regular dose of 100 milligrams of lactoferrin a day, and it seems like it actually has a very salutary effect at decreasing acne. So this is a study where they actually did that, and again, they mix it with small amounts of other kind of vitamins, I think, just to kind of so they can have a patent. These guys did the exact same thing, and the lactoferrin, yeah. So I would say that the only obstacle to using lactoferrin is just you have to purchase it, because it's not something that normally you can get a prescription for. But it would be actually very, very kind of like a low risk, high yield kind of intervention, and would be something that would be, I think, good for acne. All right, so that's everything I had to say about acne for today. I hope you found it educational. If it's something that you think other people would like to know, then don't forget to like and subscribe and share the video, because not everybody is so lucky that they go to RBK that they have people that make these kind of videos for them. So if you share it, then what will happen is Google will tell other people that this is actually a good video for them if they're suffering from acne, and perhaps we can help people with acne out there, because it definitely is a big problem. All right, thank you. I'm Dr. Reilly. Bye.